Well, with the likely overdose deaths of 3 people in Venice, we want to take a closer look at the rising danger of fentanyl and other synthetic opioids. Clinical nurse specialist Alice Benjamin joins us now. Thanks for being with us on this holiday, Nurse Alice.
Thanks for having me.
Let's start with fentanyl. What is it and what makes it so dangerous?
So fentanyl is a synthetic opioid. So it's actually a Schedule II drug, meaning there are medical reasons for us to give this. We give this for people who are in severe pain. But the problem is now we're starting to see this on the illegal market. We see people who are, now starting to use this, or it's laced in their drugs, which is causing a very big problem because it's a very potent drug. And even the smallest amount can be lethal for some people, especially when they don't know that it's in the drugs that they're using.
And that's just it, isn't it? That just the tiniest amount can be deadly. And so a lot of people, when they're buying drugs, probably have no idea that fentanyl has been mixed in?
Absolutely not. Fentanyl is 30 to 50 times more potent than heroin, 80 to 100 times more potent than morphine. And so it gives this euphoric feeling. It's potent and, it makes people, quote unquote, feel good. So these drug users are putting in this fentanyl, which is very cheap to make because they can make it in a lab. They're lacing their drugs with it. And unbeknownst to the buyer. So the buyer thinks that they're just getting a drug that's going to make them feel better, not knowing how lethal it is because it is laced with fentanyl. Very, very, it's a drug that can cause an overdose and death in a matter of minutes.
Well, the CDC says at least 70,000 deaths over the past year can be attributed to synthetic opioid overdoses, such as fentanyl, and that includes thousands of teens and young people. So what do parents need to watch out for here?
I think it's very important that parents start to have conversations with their kids, and dare I say, not even just their kids, but their coworkers, their friends, their families, because many of the deaths that we're seeing are, in our younger adults. If something today might start off with, using pot or drinking alcohol, but let's have those candid, non-judgmental conversations about what fentanyl is, how dangerous it is, if someone is experimenting with someone, and let's try to get to those underlying issues. Maybe they need counseling for their substance abuse. And if all else fails and someone continues to use or experiment with drugs, we need to have Narcan on board in the home. I know it's something that we don't want to plan for, but in the emergency room, we see it a lot. And we just want everyone to be safe. As
a healthcare provider, when you see people coming into the emergency room who have survived a fentanyl overdose, how do you work with that person? In those situations, basically, we're trying to save their life initially, because even though we can give Narcan is short acting. Some people need several rounds of Narcan to offset that fentanyl. But, once we've gotten them stabilized, we have a candid conversation about them and their drug use, their patterns, where they're getting their drugs from. And we never promote drugs. We discourage it. We try to get them counseling and treatment. However, if that is not an option that person chooses to elect, we talk to them about safer choices, about, if you are, heaven forbid, going to use drugs, don't use alone. Make sure that there's Narcan available to you. There are even testing strips where you can test your drugs to see if they're laced with fentanyl. You could, we look for options like that. But again, we discourage them from using drugs. But if they're going to use, we provide them these options. Yeah. Well, Nurse Alice Benjamin, thanks for your insight on this. We appreciate it.
Thank you.